In Module 4, we'll be looking at altered body composition, metabolic syndrome, and type 2 diabetes. Overweight is the most common type of altered body composition and is associated with a high incidence of cardiovascular disease, metabolic syndrome, hypertension, and dyslipidemia. Blood sugar imbalances are a contributing factor to being overweight and is a major health concern as well. Achieving and maintaining proper blood sugar levels is essential for good health, as prolonged unhealthy blood sugar metabolism can significantly affect the health of nerves, eyes, blood vessels, kidneys, and the pancreas. It can also impact weight, body composition, energy levels, blood pressure, and overall cardiovascular health. Insulin resistance is a form of unhealthy blood sugar metabolism, and it frequently goes unrecognized. But it can often progress to the point where signs of significant health deterioration occur. Insulin resistance is a significant risk factor for the development of type 2 diabetes, hypertension, heart disease, and polycystic ovarian syndrome. If we picture our health as a road which starts on the left with a healthy body composition, which then becomes altered over time due to diet and lifestyle factors, we see that low energy levels as a result of blood sugar imbalances can precipitate such conditions as metabolic syndrome. This condition, which is characterized by excessive central fat deposition and overall fat mass that is too high, as well as insulin resistance, places one at an increased risk of a heart attack or stroke. It can progress on to metabolic syndrome with cardiovascular risk factors, where tests will show elevated cholesterol, triglycerides, and blood pressure, increasing risk of disease even further. Finally, the end of the road is full-blown type 2 diabetes. This road does not have to go only in one direction, however. With the right intervention, you can move back down the path away from diabetes and metabolic syndrome towards a healthy body composition and improved insulin sensitivity and energy levels. Now, it's important to recognize that body composition is more than just your body weight as measured on a scale. Your weight alone is not a definitive assessment of body composition, as it does not distinguish between lean or muscle mass and fat mass, nor does it differentiate where the fat is deposited. In the same way, body mass index, or BMI as it's commonly referred to, is not an accurate measurement of body composition either. So although some people clearly have an elevated BMI, others who fall into a normal BMI classification may still be at risk because they have altered body composition. This phenomenon is known as a skinny fat or metabolically obese individual. So having a normal body weight but excess fat mass with regards to muscle can actually result in disease risks that are similar to those who are actually classified as being overweight or obese. Another aspect to consider with regards to body composition is that as one ages, there is also a tendency to lose muscle mass. So the ratio between muscle and fat mass changes. Your body composition changes just with age. So this can lead to altered body composition, which can then contribute to disease development. Sarcopenia is a condition of muscle wasting that is often found in the elderly, as well as chronically ill patients. And here we can see that sarcopenia can actually be caused by high glycemic meals. High glycemic meals cause a spike in your blood sugar and cause your body to release excess insulin. Over time, this can lead to insulin resistance and inflammatory hormonal changes. So diet itself can trigger muscle wasting. As I'm sure you all know, managing the blood sugar response after meals is crucial in the management of diabetes. But what's interesting is that postprandial hyperglycemia, the blood sugar spike that occurs after eating, has been linked to oxidative stress and increased risk of a cardiovascular event even in non-diabetics. This illustration depicts the importance of eating a healthy, nutrient-rich diet containing unrefined carbohydrates from whole foods. Through normal, healthy digestion, unrefined carbohydrates are progressively broken down into smaller sugars, which are then absorbed through the intestines into the blood. This sugar absorption stimulates the pancreas to secrete an appropriate quantity of insulin into the blood. This then facilitates the delivery of the sugar into the cells throughout the body. Your body requires a steady state of fuel at all time, even during sleep. While protein, fats, and carbs can all be used for fuel by most cells, the brain requires glucose. Up to 75% of the glucose used at rest will go towards fueling the brain. And blood glucose levels need to be maintained in a very narrow range for optimal functioning. This is how it's done. Blood sugar levels are controlled by a complex system involving the liver and the pancreas. Homeostasis, or balance, is achieved by the pancreas, which responds to the stimulus of rising or declining blood glucose levels. With a rise in blood glucose, the pancreas secretes insulin, which tells the body cells to take up glucose for energy production, and the liver to take up glucose for energy storage. The blood glucose then starts to fall, and the stimulus to the pancreas stops. If blood glucose levels drop too much, however, then the pancreas secretes another hormone, glucagon, which targets the liver and tells it to break down stored glycogen, which is then released as glucose into the bloodstream. The resultant rise in blood glucose levels then switches off the stimulus to the pancreas. And in this way, balance is maintained and there is always enough blood sugar available for the body to function. But we know that in reality, many people are not able to maintain a healthy blood sugar balance and will suffer from either hypo or hyperglycemia. Hypoglycemia happens when there's not enough glucose in the blood. A hypoglycemic reaction usually comes on very suddenly and can happen as a result of strenuous exercise or if one skips a meal. Typical signs and symptoms are sweating, trembling, dizziness, mood changes, excessive hunger, headaches, blurred vision, or extreme tiredness and paleness. Hyperglycemia usually occurs more slowly over several hours or days. It may be caused by problems with insulin production or with insulin sensitivity. Could also be a result of illnesses such as colds or flu, an infection, or eating too much of the wrong kinds of foods with a high glycemic impact. Typical signs and symptoms differ from hypoglycemia. Here we see dry mouth, extreme thirst, and frequent urge to urinate, drowsiness, frequent bedwetting, or stomach pains. A healthy diet which contains high quantities of complex carbohydrates from whole foods will be digested and absorbed more slowly, leading to a slower, more gradual increase in blood sugar and a resultant slower release of insulin. These low GI foods contribute to a reduced insulin response. So both basically with low glycemic index foods, such as proteins and complex unrefined carbohydrates, the pancreas will produce insulin on an as-needed basis at a steady rate. This insulin that is released will then bind to receptors located in the cellular membranes and will trigger communication within the cell. The ability of insulin to bind to receptors and the strength of the signal that is produced depends on adequate levels of certain nutrients, such as vanadium, chromium, magnesium, alpha-lipoic acid, and inositol, among others. Lipoic acid and vitamin E also support the strength of the insulin signal directly, as well as through the reduction of inflammatory cytokines and other inflammatory mediators. And we'll see later why this is important for insulin resistance, the link between inflammation and insulin function. The insulin signal is then relayed within the cell and stimulates the production and mobilization of vesicles containing GLUT4 molecules. They travel to the membrane of the cell, where they fuse to the membrane surface and create channels so that sugar can be absorbed. The sugar is then utilized for the production of energy by the mitochondria. So GLUT4 is the insulin-sensitive transport protein embedded in the cell membrane and is responsible for transporting glucose into the cell. This article highlights how the GLUT4 sugar transport vesicle is stimulated by insulin and exercise, and impairment in their function is the most obvious cause of insulin resistance. Proper kinase signals will also help to promote a proper, healthy insulin response. Here we can see GSK3 and PI3K, which are kinases correlated with insulin function. GSK has a continuous rhythm. The problem is when it is overactivated, it causes inflammation and insulin resistance. However, when functioning normally, you'll see it allows the insulins to bind to the receptors, and this facilitates adequate glucose absorption into the cell. Now let's look at what happens when a diet is full of refined carbohydrates and simple sugars. These simple sugars are absorbed very quickly, causing rapid elevation of blood sugar. Foods that cause such an increase are classified as having a high glycemic index. The pancreas responds by releasing an excessive insulin output. With excessive stimulation of the insulin receptors, because of the high insulin release, the receptors start to become less and less responsive. This is the beginning of insulin resistance. And then we also see that the internal message to the cells is weaker, thereby compromising the efficiency of the cell. Another aspect that can affect the insulin signal is inflammatory mediators such as NF-kappa B and the cytokine TNF-alpha. When this happens, it attenuates the internal message from insulin. It means that less GLUT4 vesicles are formed and therefore glucose uptake is compromised. A diminished insulin signal is unable to direct the sugar transport vesicles to fuse with the cell membrane, reducing sugar transport into the cell. This is associated with NF-kappa B and inflammatory mediators, as well as altered fat and sugar metabolism. So here we can see how kinases can be negatively influenced by the wrong message. So here we've got a trigger or a message coming from a highly processed junk food. And what that does is it stimulates GSK3 excessively. And without modulation, this overstimulation of the GSK3 kinase leads to insulin resistance and poor glucose utilization. In addition, the GSK will go on to trigger NF-kappa B and another kinase, you'll see there. And what that means is it then sets off an inflammatory cascade in the cell, which then also reduces insulin and glucose function. With impaired insulin function, the pancreas starts to secrete more and more insulin to try and compensate for the fact that the insulin isn't working. It creates a state of hyperinsulinemia and insulin resistance, which leads to poor glucose utilization and reduced glycogen storage. The GSK3 kinase is overactivated, which drives inflammation, and the fat cells start to store more and more fat. They get swollen up. And this also starts to affect peripheral tissues and organs. So the skeletal muscle tissue, the liver, and the pancreas start to store fat and become inflamed as well as insulin resistant themselves. So you can see that insulin resistance has ramifications throughout the body. There is a continuum of insulin resistance which starts with a healthy individual that is insulin sensitive and has a resultant healthy blood glucose level. In early metabolic syndrome, individuals may be borderline insulin resistant, but they still have the ability to compensate for the insulin resistance. What they do is they just increase pancreatic insulin production. So the blood sugar level actually remains within an acceptable range. But over time, the pancreas becomes less and less capable of maintaining this high level of insulin output. And what we see is reduced glucose control and ultimately the development of type 2 diabetes. So let's have a closer look at this metabolic syndrome, which has had various other names in the past: Syndrome X, insulin resistance syndrome, but now it is officially known as metabolic syndrome. And essentially what it is it's a cluster of symptoms. But what makes it so important to recognize in an individual is the fact that if someone has metabolic syndrome, they have a much, much higher risk of developing type 2 diabetes, heart disease, as well as a number of other dangerous conditions: kidney damage, liver, fatty liver, as well as dementia, cognitive decline. It's really seen as a gateway condition that leads to a whole host of chronic diseases. And therefore, it's very important to screen patients and be able to identify if they do indeed have metabolic syndrome. So, how it's essentially diagnosed is looking at 5 criteria. In order for them to be diagnosed with metabolic syndrome, they need to meet at least 3 of the 5. It can be any 3 of these 5 criteria. And the criteria that are looked at is having an elevated waist circumference, having an elevated triglyceride level, reduced HDL levels, elevated blood pressure, or an elevated fasting glucose. A combination of any 3 of those classifies someone as having metabolic syndrome and therefore places them at a much higher risk for all those conditions we looked at previously. The ApoB, ApoA1 ratio is another risk factor that has been identified as having great value in health screening and looking for the risk for metabolic syndrome, and also to be monitored during lipid lowering therapy. Apolipoproteins are subfractions of LDL particles and have been recognized as additional markers for metabolic syndrome. A ratio greater than 0.8 would essentially represent an elevated risk. Now let's have a closer look at type 2 diabetes. As you probably all know, there are 2 kinds of diabetes. Type 1 is a result of beta cell destruction, so the cells in the pancreas that produce insulin, and it's a insulin deficiency. And this destruction of the beta cells could be autoimmune or from an idiopathic etiology. Type 2 is, however, characterized by insulin resistance, as well as impaired insulin production and increased glucose production. It may be insulin or non-insulin requiring. Nutritional factors have been strongly linked to the development of type 2 diabetes, and numerous studies have shown that a Mediterranean style of eating is associated with reduced risk. So the intake of whole grains, fiber, nuts, and even moderate alcohol consumption may reduce risk. Lifestyle change, which includes dietary modification as well as stress and exercise management, has actually been shown to reduce the prevalence of metabolic syndrome by as much as 48%, while intervention studies in at-risk populations found the diabetes incidence was reduced by a remarkable 42 to 63%. Lifestyle change can be as effective as insulin therapy in poorly controlled type 2 diabetics, and it has been found to prevent weight gain as well as have benefits on adipokines, which are chemical messengers released from adipose tissue, which can affect, among other things, levels of inflammation. Specific nutrients have been shown to impact blood sugar metabolism, and much work has been done exploring the relationship between chromium and glucose tolerance. Chromium promotes glucose uptake by the cell and may affect the action of insulin. Chromium deficiency is associated with elevated blood sugar levels, high cholesterol, and the development of plaque on arterial walls. Beneficial effects of supplemental chromium on blood lipids, such as cholesterol, have been reported in controlled trials. Recent studies have also suggested that chromium can significantly reduce blood sugar levels in type 2 diabetics. Alpha-lipoic acid is a natural compound that supports blood sugar transport, metabolism, and utilization. Thus, it may promote healthy blood sugar clearance from the bloodstream. A human trial demonstrated that alpha-lipoic acid can improve insulin sensitivity in patients with type 2 diabetes. It also helps protect and maintain the structural integrity of body tissues, such as the eyes, by inhibiting the formation of damaging protein sugar complexes, known as advanced glycation end products, AGEs. Furthermore, it provides antioxidant protection and helps improve blood flow to peripheral nerves. A number of trials have shown positive results with alpha-lipoic acid in the treatment of diabetic polyneuropathy, a complication of diabetes. Here we can see further studies that show lipoic acid stimulates glucose transport more effectively than certain medications like metformin. And it also shows how it lowers lipid peroxidation and inflammatory markers, as well as glucose metabolism, having a benefit for glucose metabolism in the mitochondria. Cinnamon is a dietary ingredient that has been shown to reduce serum glucose, triglycerides, LDL cholesterol, HbA1c, and total cholesterol in individuals with type 2 diabetes. Studies show that 1 gram taken daily improved fasting glucose, triglycerides, LDL, and total cholesterol levels. A study in diabetes care showed that cinnamon improves blood glucose in patients with type 2 diabetes and also stimulates glucose uptake and glycogen synthesis in a similar level to insulin. Fenugreek has a hypoglycemic effect that is thought to be largely due to its high content of soluble fiber, which acts to decrease the rate of gastric emptying, thereby delaying the absorption of glucose from the small intestine. It has been suggested that a specific amino acid, hydroxyisoleucine, which represents 80% of the free amino acids in fenugreek seeds, may possess insulin-stimulating properties. Fenugreek also contains compounds like trigonelline and coumarin with reported hypoglycemic properties. Large amounts of chlorogenic acid exists in green or unroasted coffee beans. However, the high temperatures used to roast coffee beans to make them suitable for use in coffee actually breaks down much of the chlorogenic acid. Thus, the focus has been on using concentrated extracts of green coffee beans, which contains higher amounts of chlorogenic acid. So how chlorogenic acid helps is in vitro and in vivo research has found that chlorogenic acid has the ability to regulate blood sugar concentrations after meals by acting on the intestinal absorption of glucose and glucose tolerance. Studies report that chlorogenic acid has a beneficial effect on blood sugar levels when consumed as part of the diet. Beta-glucan can also be used favorably. High amounts of beta-glucan in barley products exert beneficial effects on glucose tolerance and blood lipids. The intake of the barley diet significantly lowered the fasting plasma glucose and glycosylated hemoglobin levels and decreased plasma total cholesterol, triglycerides, as well as free fatty acids in one study. Long-term intake of barley has beneficial effects on glucose tolerance and lipid metabolism and suggests the intake of unrefined cereal foods should increase as a diet therapy for type 2 diabetics. Green tea catechins, known as EGCGs, are essentially responsible for enhancing weight loss. How they do this is they increase the amount of energy your body uses and make it easier for your body to use excess body fat. You can increase your weight loss up to 100% by taking green tea catechins, according to a study published in the February 2009 issue of the Journal of Nutrition. Green tea catechins also allow you to lose more fat from your abdominal area. While green tea catechins seem to be effective at promoting weight loss, the catechins found in other foods do not have the same effect. You can actually get green tea catechins naturally by drinking a glass of green tea, or you can take it as a supplement. A daily dose of 270 milligrams is noted as the effective level, according to a study published in the December 1999 issue of the American Journal of Clinical Nutrition. The average cup of freshly brewed green tea has 25 to 30 milligrams of the green tea catechins. So you can see you'd have to drink a considerable amount of green tea on a daily basis to really get a therapeutic dosage. So this is where supplements could come in handy. All right, this brings me to the end of the slide presentation, and I'm just going to highlight 2 articles which you can request from your AmiPro rep. This one entitled Herbal Support for Diabetes Management, and another which is Nutritional Support for Insulin Resistance, if you'd like to get a bit more detail, see some references on some of the facts that were presented in this presentation. In part 2, we're going to be looking at some metagenics products and protocols that could be utilized to manage this subgroup of patients.